Wonderful. So I'm going to go ahead and introduce our speakers quickly. I don't have any slides for that, so just the main slide is okay. So first off, we have Jocelyn Holbert. Jocelyn is a public health analyst with the Health Resources and Services Administration within the EMSC, within the Maternal Child Health Bureau. In this role, she serves as a federal project officer for EMSC state partnership grants, providing technical assistance in project planning. Next, we have Anna Sessa, and Anna has been in the New Hampshire EMSC state partnership program manager role for 4 years and a working paramedic since 2013. She loves the diversity the management position brings and thrives on the teamwork setting that HRSA has created. Next is Amanda Perry. Amanda has been the Louisiana EMS for Children manager for 3 years and a paramedic for 13 years and briefly taught high school English until the EMS profession sucked her back in. Next, we have Lori Warnock, and she is a New Hampshire Education Coordinator for the Northern New England Poison Center. She also works as a program coordinator for the New Hampshire Project FIRST, addressing opioid use disorder response among first responders. And last but not least, we have Victoria Barnes, and Victoria is a registered nurse and EMT from Connecticut. She's the 3rd generation of her family to serve in the volunteer fire EMS service. So without further ado, Jocelyn, if you'd like to take it away.
Thank you so much, Sophia, and welcome everybody to the first of a 2-part orientation really for state partnership, new state partnership managers and new FAN members and anybody else who decided they wanted to join. Next slide, please. Can we have a change of slide? Thank you. We have a lot to cover in a very short period of time today. I just want to give you a sense of what we'll be talking to you about. And that, sorry, I'm hearing background noise. Thank you. Thank you for muting. We'll be going through giving a bit of background on the EMSC structure, the program structure, and the state partnership program specifically, talking a little bit about FAN and what FAN means, and going through the performance measures, and then giving you a better understanding of the roles of our 2 resource centers, NEDARC and the EIIC. Next slide, please. As Sophia said, I'm Jocelyn Holbert with HRSA. I'm one of the project officers. I work with a number of the states and function in other roles for HRSA for supporting the state partnership program. Next slide, please. I want to start out by just thanking all of you who are here, whether you're new or you are a seasoned EMSer. Thank you for tuning in today to hear what we have to share with you. And thanks for really just for being a part of this team, the EMSC team. We have a number of wonderful people who are associated with this program, and we thank you for coming. I'd like to start out with showing you, which you probably saw today when Dr. Warren was talking, that the EMSC program has its own legislation that clearly describes who can be recipients of EMSC grant funds. Having our own legislation is significant and special in a number of ways. The approved recipients of EMSC state partnership grants are states, usually the State Office of EMS or similar, and accredited schools of medicine. Recipients of these funds are specifically charged with expanding and improving EMS for children who need treatment for trauma or critical care. And state partnership grants are funded by HRSA for 4 years, with the option of a 5th year if we are able to provide that to you. And there can be no more than 3 EMSC grantees of all kinds in any given state. Next slide, please. So this next slide is just a snippet of a very important document that lives on the EIIC's website. We refer to it as our historic perspective. It's kind of a timeline that describes all of the work that has gone on with EMS for children around the country, spanning from really the 1966 to 2019. It's a significant timeline, and I would encourage any of you all to take a look at it when you have time. We don't need to go through it all today. We don't really have time, but a couple of things I would like to cover with you that are on this document are, why EMSC as a program was created. And as you saw in the previous slide, the EMSC program is charged with expanding and improving emergency care of children, no matter where they live or where they travel in this country. In the late 80s and early 90s, EMS and emergency care of children looked very different than it does today. There was no specific system of emergency care for children. The EMS system that we had at the time was still very adult-based, and many of the treatment protocols were based on lessons learned while treating wounded soldiers in the Vietnam War. Those lessons were brought back home and helped form what was and what we now know as our EMS system. However, there were no lessons learned on treating pediatric patients, so very little was understood about the difference in treating adults and pediatric patients back then. The EMSC program is and was the only federally funded program to look exclusively at the emergency care of pediatric patients. To help integrate patients into our EMS system, state partnership grants were introduced in 1996 to help states improve and refine and integrate PEDS care within the state EMS system. There was never the intention that PEDS would become a separate system of any kind, but would be integrated into the system that we currently have today. Since that time, a state partnership grant program has worked to institutionalize pediatric-centered care, healthcare programs within states and territories, and promotes the. Hi, we're having some background noise. Can everybody please mute? Thank you. I'm sorry, let me get back to where I was. Promote the
6431.
I keep wanting to do that.
Jules, can you please mute yourself? Thank you. Healthcare programs with state and territories and promote the value and importance of integration. The state partnership program aims to establish a universal presence across all 59 states and jurisdictions, just to ensure that children receive optimal emergency care. Each state and jurisdiction works to improve the same pre-hospital and hospital performance measures, which you'll hear more about in a moment, representing the largest national effort to standardize pediatric emergency care. The state partnership program funding for demonstration projects, which is just the terminology that HRSA uses for this type of funding. In each state and jurisdiction, we now have reached all states and all U.S. territories with our funding. And each grant recipient works to achieve the EMSC state program objectives, which are designed to monitor and measure the impact of the state and jurisdiction level and are in alignment with established targets for the program performance measures, which everything seems to come back to. Real quickly, I just wanted to mention a few things about the timeline that you see before you and how much it really it exemplifies how much things have changed from when the program was created. From 1975 to 1979, gaps in pediatric emergency medical services were identified. That was really the first time this had been looked at. State EMS systems were known to dramatically improve outcome for adults, but their pediatric surgeons, pediatricians, and others, concerned groups, began to realize that children's outcomes weren't keeping up pace. So in 1979, Dr. Cal Sia from Hawaii, who was the president of the Hawaii Medical Association, urged members of the American Academy of Pediatrics to develop a multifaceted emergency medical services program designed to decrease disability and death in children. In about 1983-84, Senator Daniel Inouye, also from Hawaii, joined the crusade after learning about the emergency care provided to a senior staff member's daughter. Her treatment demonstrated the average ED's shortcomings in treating a child. And then Senator Orrin Hatch from Utah and Lowell Weichert from Connecticut, backed by other staff members in Congress, had similar experiences and joined in this push to sponsor legislation to create the EMSC program. So in 1984, federal funds for EMSC were enacted, which was huge. In 1986, the first EMSC grants were awarded to Alabama, California, New York, and Oregon. And then in 1989, we added 4 more states, New Mexico, North Carolina, Ohio, and Utah. Since then, all states and U.S. territories have received EMSC funding. In 1991, pediatric emergency medicine became an approved subspecialty in medicine. And in 97, state partnership grants were introduced. Prior to that, the funding was a little bit different, and it formally was introduced as state partnership programs. In 1999, the Family Advisory Network was created, and EMSC recognized that families are a valuable resource in the planning and development and evaluation of pre-hospital and acute care services for children. And EMSC FAN representatives impart a consumer's perspective and serve as community allies to support patients and family-centered healthcare throughout the continuum of care. In 2004, we developed the first set of EMSC performance measures, and they were rolled out in 2006. And in 2009, ambulance equipment guidelines were updated, and EMSC adopted specific pediatric equipment recommendations as part of one of our performance measures. In 2012 and 13, the National Pediatric Readiness Project was created and implemented with a huge impact. Over 4,000 emergency departments participated in the survey, and we had a response rate of over 82%, which clearly delineated gaps in care in the emergency department level specifically. 2014, EMSC turned 30 years old, hard to believe, and in 2016, the EMSC program began to focus on quality improvement. And in 2019, the program was reauthorized by Congress. Now, these are only a few of the achievements of the program, or not so much achievements, but just the progression of how things have changed through the years. And we are, certainly not done, but, we are moving ahead. And next slide, please. Working with national partners to, thank you, expand the effectiveness and reach of the program. As you can see on this slide, there are numerous very, very important partners to EMSC that have made all of the things that I just elaborated on possible. we wouldn't be where we are today without the help of our national stakeholder organizations. And if I didn't say it earlier, I should point out that EMSC is the only federally funded program that looks at pediatric emergency care exclusively. So it's very needed in this country. Next slide, please. I referenced family-centered care, which is the premise of our Family Advisory Network throughout my comments today, and you will hear that throughout the meeting over the next 3 days. I wanted to provide you all a formal definition of what we see as family-centered care. Family-centered care improves the patient's and family's experience with healthcare, reduces stress and improves communication, reduces conflict, including lawsuits, and improves the health of children with chronic health conditions. We see this at EMSC as one of the most important core values of what we do within the EMSC program. And I wanted to state that early and often throughout today's presentation. Next slide, please. Thank you all so much for being here today. And I would like to now hand this over to my lovely colleague, Anna Stessa from New Hampshire. Anna?
Thank you, Jocelyn. Welcome, everyone. If I could take a moment and just ask, there are a couple newcomers who have come in. Can you please put yourself on mute so that speakers are not interrupted? I would appreciate it. My name is Anna. I'm going to chat with you all about the basic structure of the EMSC State Partnership Program, where it falls in the larger scheme of EMSC under HRSA. I'm actually a resident of Vermont, but I am the New Hampshire EMS for Children State Partnership Program Manager, and I've been in this role for just over 4 years. Next slide, please. So as we look at the structure of EMS for Children, it falls under the Health Resource and Service Administration under the Maternal Care and Health Bureau. Next slide, please. And under EMS for Children, we have 3 arms. The first one on the left are the funded programs. So the State Partnership Program is one. We also have targeted issues grants, the PECC network, which is a network of hospitals that collect great data on pediatric care. And then we also have the SPROC grants, which are State Partnership Regionalization of Care. In the center circle, you'll see NEDARC, and Braden Green is actually here to speak on NEDARC. And he is the MPA Training and Development Coordinator. Sorry, we missed you at the beginning introductions, Braden. And then finally, the last arm, EMSC Innovations and Improvement Center on the right-hand side. Next slide, please. Hey, Joss, you're still, your mic's still live. And all 3 of these arms of the EMS for Children program work alongside each other and support one another. So none of these individual ovals could survive without the other 2. You could argue that one oval could stand, but we really rely on one another for support in progressing our efforts and also collecting data so that we can progress our efforts. Next slide, please. So I'm going to start talking about the funded programs. And as you'll see, next slide, please. I'm going to put each of the ovals that we're speaking of in the top right-hand corner so you can kind of follow along which of the arms of EMS for Children we are talking about. Next slide, please. So the State Partnership Program allots funds to each of the 50 states of the United States and also offers funding to the associated territories, which bring a lot of character to our program, and I really appreciate them. I don't think that they get enough airtime as they deserve. Next slide, please. And then today, when we speak of the state partnership programs in the FAN, you're going to hear from myself up in New Hampshire, up in that right-hand corner, of course, of the states. And you'll also hear from one of our fans, which is Lori Warnock. You'll probably hear actually a lot from her over the coming days. She's a very shy and timid human being. And then you're also going to hear from Amanda Perry, who's down in Louisiana. Amanda, we love that you're here and appreciate that you are taking the time right now while your states and friends are kind of in turmoil. So we appreciate you being here and appreciate your safety. Next slide, please. So the state partnership, I broke down into 3 categories to kind of give you a flavor of what the state partnership program looks like. There's personnel, right? So there's typically a primary investigator or a program director. And then there is typically a program manager who runs the day-to-day work. And we have our FANs, of course, our Family Advisory Network representatives. And then typically states will have an advisory committee as well. And there's 8 to 9 required individuals that sit on that advisory committee. The mission, as you probably know by now, is to decrease illness and injury to pediatrics when they're seeking emergency care and providing an equality of care across locations and cultures and geographic and economic areas. And finally, there are processes which we'll talk more about with the performance measures and how to approach these and involving stakeholders and how many hats you will wear as a state partnership program manager. I'm also going to put, because I know we have a couple of new state partnership program managers, I'm putting my email in the chat box. Feel free to reach out to me if you ever need help or guidance or have a question. There are no silly or stupid questions, just the ones that are not asked. So please reach out. I think you'll find that the network of state partnership program managers are absolutely supportive and happy to help. Hey, Amy, you're unmuted. If you could mute yourself, please. Next slide, please.
Thank you.
You're welcome. Thanks. Next slide, please. So I'm going to hand it off at this point to talk about specifically the role of FAN, and that's going to be one of my 2 fans, that's Lori Warnock.
Hi there. So I am a veteran fan, as Anna mentioned. I have been with the New Hampshire EMSC program since 1995 when I was working as a clinical educator for the grant. And then in 1999, I reproduced, which qualified me as a Family Advisory Network representative. So it was an interesting transition. Let's move ahead to the next slide and see what we've got there. There we go. Okay. So this morning when we listened to Dr. Warren, he mentioned using your trusted voice as a means of getting messaging out. And in our cases, family representatives, it isn't always a trusted voice when it comes to talking to medical professionals, because if we are non-medical people, our background, our informed experience is something they may not necessarily be familiar with. So it's our job to make sure that we're able to convey the family experience, expertise, and perspective. It is an invaluable part of your child's care, which as child care providers, as parents, keeping our children alive, we understand. But often there can be sort of a disconnect between that home life experience and the in-hospital experience, and somewhere even in the transition from home to hospital in the EMS sort of realm. We also act as a force multiplier. Anna can only do so much. She's actually working up in one corner of the state. I live in another corner of the state. It's a small state. I can drive to the top in about 4 hours, but this gives us that sort of divide and conquer, or sometimes back each other up. We both sit on the state protocol committee, for example, and I sit there as the face of poison as an educator for the Poison Center, but in my secret identity as her family advisory network person, I can also support whatever pediatric-based changes or specific protocols that she is promoting. I can certainly back her up in that. And also as a non-employee of the grant, I can act as an advocate when it comes to legislative issues in ways that she can't. So we have, that sort of flexibility in what we as a family person, as the voice of the family, can provide and can sort of supplement to what Anna does, both in the advisory committee, when it comes to the actual program materials. Sometimes
ding, 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 ding. We have a winner.
Jason?
Hey, Jason,
Winner of
you're
the
unmuted.
Crazy,
Jason.
the Crazy Award.
Jason?
Yes.
Hi.
Please mute
Are you
yourself.
ready?
Jason, can you mute?
Here we have one Lieutenant Robert
So
of the
apparently
Providence Fire Department.
Jason has got some other activities going on.
Zach forwarded this.
I don't know if one of our moderators
Dear
can
sir, this is
give us a hand in kind of
department.
shutting him down. But in any case, so
I
that is the role.
respectfully request to inform the Providence Fire Department. I don't even understand that first sentence. You inform.
Jason, can you hear us?
I'll try and email him real quick.
There, he did. He's muted. He's been muted. There we go. Okay. So congratulations to whoever that was in Rhode Island that just won a prize. But in any case, so we have a variety of roles that we can serve, both based on our experience, based on whatever our current role is in our other life. So as I mentioned, working in my professional capacity, and also working as an advocate from a legislative sort of perspective as well. Next slide. Okay, we can go past that one. All right, Amanda.
Hey, good afternoon, everyone. I am going to give you all an overview of what the performance measures are for the EMS for Children program. So my target audience is obviously fans. If you've heard this before, it probably wouldn't hurt you to hear it again, but just keep in mind that I was speaking to the fans whenever I created the presentation. Next slide. So what today my objectives are for you guys are I want to familiarize the fans with the performance measures, get them to understand the importance of the performance measures, clarify how the fan can support the EMS for Children program to meet the performance measures, and then explain some of the various considerations for strategizing for success, which also means lessons learned. Next slide. And we can move to the next slide. So I'm not going to read the performance measures to you guys. You know they're available. If you're not sure where they are available, talk to your EMS for Children manager. Also, we can put a link to the website. It's open public information. So there's a link to a website that we can share with you guys where the performance measures are. My main message to you guys is going to be at the bottom of each of the slides. Where it should be blue questions. I believe I made them all blue, but these are the things that fans should consider when talking to their EMS for Children program director, project directors, and program managers. Some questions that you might think of asking to your program managers. And if you are a program manager, you're welcome ahead of time because I have given your fans homework to bring to you if these discussions have not already taken place. So just to kick things off, performance measure number 1, NEMSIS Data Submission. This is EMS specific data that's being submitted to a state registry. And the performance measure says that by the end of this year, by the end of 2021, 80% of the agencies in your state should submit NEMSIS data. So some of the questions that you could ask are, have we shown improvement in this measure from the last 3 years? What challenges keep us from reaching the 80% goal? And does our EMS for Children program have access to the state's NEMSIS data? So some considerations, what challenges keep you from reaching the goal? Here in Louisiana, your challenges may be similar or very different, but here in Louisiana, we have a lot of rural agencies that still use paper health records. They don't even have electronic health records, therefore they don't submit NEMSIS data. It's really a funding issue, and so we're working through that as a state. And then does your EMS for Children program have access to the state's NEMSIS data? I cannot directly log on to the NEMSIS data system here in the state, but I have a good relationship with the body, the organization. It's called Learn here in Louisiana. I have a good relationship with Learn. I can email them. They can send me the data that I'm asking for, but I don't have direct access to it. So some things to consider. I'm sort of seeing some chats pop up. NEMSIS is the National EMS Information System. And it's every state has a NEMSIS data system, or they should have a NEMSIS data system, but NEMSIS is actually housed at the University of Utah in Salt Lake City. Next slide, please. So the importance of the NEMSIS data, this is how you can use your data once you have access to it. So benchmarking in EMS pediatric care. So you can set a standard, how many pediatric patients received XYZ medicine for whatever diagnosis they received in the field, and then benchmark your care, set a standard and benchmark the care. Of course, you're going to do this with your advisory board and your fellow pediatric emergency medical physicians. You can set quality improvement measures. A lot of times those are already set through the EMS agencies, but you can definitely advocate for pediatric quality improvement measures, and patient presentations, outcomes, continuity of care, those types of things can be tracked. Next slide. Performance measure number 2 is whether or not an EMS agency has a Pediatric Emergency Care Coordinator, or they have a coordination effort going on. We are closest to the second highlighted bullet down there by 2023. So in a couple of years from now, 60% of the EMS agencies in your state should have a Pediatric Emergency Care Coordinator. So the questions that you can ask as a fan based on the EMSC survey data, which every EMS for Children program manager did a survey to EMS agencies, where are the PECC pockets? So they actually have a map that they can show you of where there are PECCs in your state and where there is a gap of PECCs across your state. What geographical areas lack PECCs? Again, they actually have a map, and do the agencies fully understand the role of a PECC? And a lot of EMSC managers have developed role descriptions and job descriptions. The EIIC has a template that can be used. We have one here in Louisiana. I'm very willing to share with you guys, but these are again some questions that you can ask your EMS for Children managers. Next slide. So importance of the PECCs, really it boils down to pediatric considerations are PECC priorities. And at the bottom, we do not want pediatric considerations to be an afterthought. So if you have a person dedicated to this role, pediatric considerations are never going to be an afterthought. Next slide, please. Performance measure number 3, pediatric-specific equipment in EMS. Again, by 2023, 60% of EMS agencies should have a process that requires EMS providers to physically demonstrate the correct use of pediatric-specific equipment. So some questions that you can ask and some considerations. What challenges do EMS agencies have in securing pediatric equipment for clinical use and for education? So here in Louisiana, we have a lot of different EMS agencies and a lot of different EMS education programs, and they're not always one and the same. So I might have an EMS agency right next door to me, and on the other side, I might have an education program that's not related to the EMS agency that's on one side of me. So their equipment is different, their standards are different, the protocols don't line up with the education. These are all things the EMS agency's protocols and guidelines don't necessarily line up with the education standards as they should, and we're working towards this, always making progress on this in Louisiana. But this is something that you should ask your EMS officials and your EMS for Children manager. How can EMSC strategize to close the gap and improve pediatric focused education? One of the things that we do not have in Louisiana yet, but we are working toward, is a set of statewide pediatric education emergency care guidelines that's being put together by medical directors and EMS agencies, also pediatric emergency medical physicians that are specifically licensed in PIMS. So we're trying to close the gap in getting standardized and consistent care across the state for pediatrics. It is not a state mandate. It's not anything. It's just something that we're doing, and we're hoping to get it in legislation eventually, but again, working towards that. And then what organizations and local chapters can assist as subject matter experts. So your EMS for Children manager will know this, but I'm thinking the American Academy of Pediatrics, you have a local chapter in your state, the National Association of EMS Physicians, NAEMSP, NAEMT, there's several different organizations. So talk to your fans about which ones can help be subject matter experts on closing these gaps. Next slide, please. And the importance of the skills and the equipment is pediatric patients are, and check all of these things. We don't have a lot of pediatric patients as clinicians, but when we do get them, they're very high acuity patients. And they are not little adults, so you can't just treat them with the same protocols or the same medicines, definitely not the same dosages of medicines. And they're a specialized population that needs specialized care. And emergency clinicians are not competent care providers when it comes to pediatrics. That's not just me taking a guess at that, that's actually statistical data. And they're under pressure from family and bystanders. So you show up on the scene and you have a kid and you have family automatically, you know, in panic mode, wanting you to take care of their child, asking what you're doing, these types of things. You want them to be adequately prepared, and they're not to care for kids. So down at the bottom there, educational programs lack knowledge and resources needed to provide pediatric skills demonstrations and knowledge sharing. This is where partnering organizations can help. So just keep those partnering organizations in mind. Next slide, please. Performance measure number 4, medical facility recognition. By the end of next year, 2022, your state should have 25% of the hospitals that are recognized for medical emergencies. And I say this medical, I emphasize medical because the next performance measure is focused on trauma, and it's a little bit different, but very, very much the same. Again, there's some questions for you. What is our state's criteria or standard for recognition? Is the standard high enough to drive improvement? And is the standard too high to be attained by rural access hospitals? Your EMS for Children manager is going to know the answer to these questions. And I will just put the caveat in there that many states do not have this program developed yet. There are some states that are advanced and have had it for years. There are some states that are working towards this program development, like we are here in Louisiana. I actually have a specific committee designated strictly to this project. And there's other states that are working on other efforts. And so this has, because of resources and limitations, this just hasn't been a priority. So ask your EMS for Children manager about these efforts. Number 4, or I'm sorry, next slide, please. And the importance of medical recognition is promoting quality improvement, drive better clinical outcomes, and connect the continuum of care. So from the EMS to the emergency department to, if they're admitted into the hospital, to any kind of post-care that they receive, therapeutic related resources. And it has to be thoughtful and sustainable. Next slide, please. Performance measure number 5 is nearly the same as the one that I just mentioned, except for it's focused on trauma. And again, the same questions apply. What is your state's criteria? Is it high enough to drive improvement, or is it too high to be attained by rural access hospitals? All things to be considered. And the performance measure is a little bit different for this one because it's by 2022, you want 50% of your hospitals to be recognized. Next slide, please. So trauma recognition, patient health outcomes are dependent on hospitals' abilities to provide adequate care in a timely manner. EMS agencies, we want EMS agencies to know that it's okay to go 10 minutes further up the road to a hospital that has a higher level of care. They're actually not delaying care if they bypass a closer hospital, if the situation warrants that. They're actually providing better care by going a little further up the road, but they need to know which hospitals have these capabilities. And to be honest, many EMS agencies don't necessarily know this pediatric capabilities about their hospitals. And then communities need to know that all EDs are not created equally. I think a lot of parents just say, I'm taking my child to the emergency department. They go to the one that's closest to them, and they think that that emergency department is able to take care of their child just as any other one would be able to, and they should have that trust in the community hospitals. But whenever a hospital is not able to take care of that patient, the hospital, the burden is on the hospital at that point to identify, we're not able to care for this patient, and then get that patient out to a higher level of care in a quick, timely manner. Just because they can't actually take care of the patient in their house, but they recognize their ability to get them out quickly, that is still good patient care. Next slide, please. Performance measure number 6, by 2021, 90% of hospitals have transferred guidelines in place. Some questions here. Is there a template for these guidelines? The answer is yes. You can ask your EMS for Children program manager where those are. And what is an effective method of disseminating this information? That's something that you guys can determine in your state. Next slide. And the importance of the transfer guideline components. It's a process. So you want a quick initiation of transfer, selecting appropriate care facility. When it's going from one lower level of care to a higher level of care, you want it to go to the appropriate care facility. Making sure that if they need to go by ambulance, or if they need to go by AirMed, or even if they can just go from one facility to the next by privately owned vehicle, all of that needs to be considered in the process. And then patient transfer consent, of course, you have family involved in that process. So the plans You have to plan to transfer medical records and a copy of the transfer consent and the patient's belongings, right down to their socks and their teddy bears that came to the ED with them, making sure all of those things go with the patient and nothing is lost in the transition of care. And then even providing directions and to the receiving institution for the family, because if they go by helicopter, you can't follow a helicopter to the hospital. If the ambulance is going lights and sirens, you don't want the family running red lights. There could be a disconnect there and they wouldn't necessarily be able to follow the patient in the emergency vehicle. So make sure that they have directions to the accurate location in the hospital. Hospitals are big. They need to know where to go. Next slide, please. And performance measure number 7, interfacility transfer agreements. So by the end of this year, 90% of hospitals have transfer agreements. You can see the questions here. The very first question, what are the barriers that hospitals face to have active agreements in place? I can tell you, whenever I started as the EMS for Children manager, I thought that transfer agreements was going to be a low-hanging fruit. I really did. I was just going to call the hospitals and say, you know, we should have these in place. Here are the reasons why. Immediately, I ran into the roadblock of, that's not anything that we want to talk to you as an emergency department director. We're not going to talk to you about transfer agreements. Agreements come out of our legal department. Our legal department is dealing with this, this, and this. And I did make some connections in some legal departments, but there was not a priority for this to take place for whatever reason across Louisiana. So there are some barriers to get active agreements in place. And, you know, there may be other states who have had great success in this. I'd love to hear what they've done, but I just want to put this out there transparently. Louisiana, this was not as easy as I thought it was going to be. And other considerations, other questions, how does a hospital determine which other hospitals to enter agreements with? Are there legal barriers? Yes. How can the HPP program help the EMS for Children with this initiative? And HPP stands for Hospital Preparedness Program. Next slide, please. The importance of the agreements reduces delays and higher level of care. So there's no need to call around and search for a receiving facility. You already know which facility you're transferring your patients out to, or if you're a receiving facility, you know that there's always a possibility that you are going to receive patients at any given time if you are the higher level of care. Referring facilities acknowledge that their reduced capabilities. This is a sign of quality patient care. Like I said, just because you can't care for a patient and you know that it needs to go out quickly to another higher level of care, that's still good patient care. I put a scenario down there, but for time's sake, I'm not going to go through that. I think this is being recorded, or maybe the slides will be sent out, but you can look through that. Next slide, please. Performance measure number 8, permanence of EMS for Children. Annually, the EMS Advisory Committee should be meeting. It actually has specific required members per the implementation manual. So you might ask your EMS for Children manager, are all of the required members on the committee? You can help encourage the committee to meet at least 4 times a year. Don't let the burden be completely on your EMSC manager. They probably are doing a wonderful job, but you can encourage the other committee members of the importance of the advisory committee and the importance of meeting for relevant purposes 4 times a year. And it also incorporates and maintains pediatric representation on the board. So as a fan representative, you're representing the family, you should be there, but also you need to make sure that there's pediatric representation on the board as well. You should have a full-time EMS for Children manager that is dedicated solely to the EMS for Children program. I would love to say that I think that all EMS for Children managers are 100% dedicated to their program, but I think that that is an exception, not the rule. So you can work towards getting that encouraged in your state as well. Next slide, please. And performance measure number 9, EMS priorities are integrated in statutes or regulations. So by 2027, you want EMS priorities to be integrated into existing EMS, hospital, and or healthcare facility statutes or regulations. So just a breakdown here of the performance measures. There are 3 of them that are specific to EMS. There are 4 of them that are specific to hospitals. And then the permanence of EMS for Children, the performance measures 8 and 9. Next slide, please. And then the importance of that is you get state funding. Of course, we have federal funding. There's accountability. All special populations are considered. It should be improvement focused, identify and close gaps. You don't know what you don't know. You have to start asking questions. And like Jocelyn mentioned earlier, it is the only federally funded program focusing on pediatric emergency care. I may be a little bit biased, but EMS for children is kind of a big deal. And then it can be a model for other programs in other states. Next slide, please. You are EMS for Children's biggest fan, and really your question, your base question to your managers is how can you help support the program to meeting these measures? It is a commitment, it takes time, but you can do this strategically and with a plan. Next slide, please. I would encourage you to figure out what your passions are. So you can't do everything, right? We're not expecting everything, especially if you're a volunteer fan. But if you want to lead in any performance measure area, let your EMS for Children program manager know that. If you have a specific passion for hospital recognition or coordinating pediatric care and EMS, NEMSIS data, all of these things that are listed here that we've already talked about, you can lead in any of these areas. Just let your program manager know that you're passionate about that and that you have ideas that you want to share with them and with the other committee members. And then also assist with the grant work plan. And you're probably thinking, some of you may be like, oh, we have a grant work plan. Yes, yes, you do. Yes, you should. You can look at it and review it and pick out your priorities from there, or assist with writing it each time it's necessary to be written, which is only every 4 years, I believe. So you can strategize, develop, participate, create timelines, share data, all of these things. Next slide, please. So I don't want to end with questions. I think we're going to do that later, but I do want to say, I have a message here from Julie Johnston, who is my fan here in Louisiana. Many of you don't know her or do know her. And if you don't know her, you will eventually. But she was heavily affected by the storm. She is doing okay. Zach is doing fine. They were, as of yesterday, without power, but she wanted me to tell you guys this. She says, tell the folks at these storms spotlight how we must diligently work together to improve our performance measures. And she talked about some of the specific hospitals in the different regions in Louisiana that are affected by Ida right now. And she's like, and add on top of that, we're over capacity because of COVID already. So we're really, we really are tired and struggling here in Louisiana. And then the importance of the EMS evacuation transport system is we're committed and it's just important. All of these things are the different components of emergency care working together to make sure that our kids are taken care of here in the state. And but most importantly, she wanted you guys to know that she is doing okay and that she is so sorry that she couldn't be here with us today. Thank you.
Thank you, Amanda. Next slide, please. And next, we're going to move to NEDARC. And go ahead to the next slide. Braden, you're up.
All right, thanks. I'll actually only be covering just a couple of slides, but I do appreciate the opportunity to give a quick summary of basically NEDARC's role within the state partnership program. We can go ahead and go to the next one. All right, so one of the big roles that NEDARC, I guess two of the big roles that NEDARC fills within the state partnership program is, that's going to start back at the beginning. Cool. So really two of the big roles that NEDARC fills within the state partnership program is first to provide technical assistance and second to provide various custom software to the EMSC grantees. And that basically is, well, it's the grantees, it's EMS agencies, it's hospital EDs, it's state EMS offices, all those different people we work with. And we provide that technical assistance and the custom software in the areas of performance measures, data collection, data analysis, data communication, publishing in peer-reviewed journals, and in quality improvement. So go ahead and go to the next slide. And then performance measured data is only part of the data that NEDARC's in charge of, but the performance measure stuff obviously is critical for the state partnership program, like has been said. So this slide here shows more or less the life cycle for that data. So the performance measures themselves in the pink, they inform the data collection periods, obviously, and what we're collecting. And then moving on to data collection during 2021, we've had two surveys, two data collection periods that have been hosted by NEDARC. First was the EMS for Children survey, and it collected data for EMSC 02 and 03, which, as was mentioned, measures the presence of a PECC and then the skill checking within EMS agencies. And then also we have had, it actually ends today, the National Pediatric Readiness Project Assessment, which, among other things, also collects EMSC 06 and 07, which, as was mentioned, measure the interfacility transfer guidelines and the interfacility transfer agreements within hospital EDs. And then I just would be remiss not to mention that the state partnership managers themselves are absolutely critical to the success of these surveys. They just wouldn't go off like they do without a very heavy and concerted effort by those managers. And so we're super grateful for them and all their help with collecting all that data. So those are the two surveys we see in the middle. The next one, once that data is collected, we basically host it all and we clean and analyze that and then build visualizations in Tableau. Tableau is a data visualization software. And then each of the state partnership managers, as well as other people, a handful of other people like project directors and things like that, have access to the data visualizations within Tableau, and then they use those to move forward with various quality improvement initiatives within their state. So we can go ahead and change slides. And actually that is all that I have. So if you have any questions, certainly feel free to let me know there at the end, and we'll go ahead and turn the time back.
Hey, Braden, if you'll just drop your email in the chat box, I'd appreciate it.
Yeah.
Thank you again for being here and talking on NEDARC. Finally, we're going to get to the EIIC. Victoria Barnes is going to speak on them. Vicki, you have like -2 minutes, so no pressure. But,
and I suppose lunch is next, right?
Thanks for being here, Vicki.
Thank you. Well, good morning or good afternoon to everybody, depending on where you are in the states or territories. I'm Victoria Barnes. I go by Vicki. I work for the EMSC Innovation and Improvement Center, also known as the EIIC. I'm one of the project managers on the state partnership team. I am a past program coordinator for EMSC in Connecticut, though. So I'm not too far removed from that. So I understand what everybody is going through and will be going through. So I'm going to talk to you just a little bit about how the EIIC functions and how we can help you. Next slide, please. And next slide. And I have no disclosures. Okay, so Jocelyn talked to everyone about our mission of EMSC. I think everybody understands that well, but how do we go about getting to this mission? And we see, like Anna said, we work together as a team with all the different branches of EMSC. We have two wonderful leaders at the EIIC, Dr. Charles Macias and Dr. Kate Remick, who you heard from this morning. And I also was remiss, I didn't include Luis Gonzalez on our slide. He's our operations manager and kind of keep this all in line and in check. But what the EIIC does is we integrate a lot of quality improvement projects into EMSC. And some of the resources that we have are QI collaboratives, there's toolkits, we do different webinars, there's training modules, and we do also offer technical support. So if you go to our website, which I will type into the chat box, there is a ton of information on there. And by the way, speaking of a ton of information, we know we're giving you a lot today. Please don't think you need to remember this, that you're going to be tested on it. This is like the long game, especially for those of you that are new. Don't think you need to learn everything right away. Take things in small bites. You're going to be juggling a lot. And please reach out to us if you need anything. I put my email in the chat box. I put my cell. You feel free to call me or text me. But basically, our team will be working also with the FAN team and to help bring you together, especially those of you that are new to either aspect, either state partnership manager or family advisory network rep, just to help everybody get through all these performance measures and help support you in any way we can. Next slide, please. Just so you understand a little bit about the structure of EMSC, we have domains. I like to think of them as teams, but you have people behind the scenes working on things like disaster, trauma, pre-hospital, hospital, state partnership, which is the team I'm part of, and research. Next slide, please. That's just a little visual on that. And next slide. And then the horizontal domains, they kind of cover everything. These are folks that help us with the knowledge management, get the knowledge out there, advocacy, the collaboratives group that brings collaboratives out. We have a PECC workforce development collaborative starting in the next couple of weeks, analytics and value-based care. So a lot going on in the EIIC. We'll talk more about this tomorrow. We are also putting together a series of videos and some written materials for those of you that are new or those of you that want to brush up on these things that are kind of in small chunks and small bites, like I said. So be on the lookout for those. We're very happy to have all of our new people here, and please reach out if you need anything at all. Thanks.
Next slide, please. And next slide, please. Thank you everyone for being here. I'd like to open it up. I recognize that we are moving into lunchtime and everybody's ready to eat, I'm sure. Does anybody have any final questions? You can put them in the chat and I will read them out loud and direct them as needed.
While we're waiting for questions, Anna, I'll start my video here so that you can see me. Hi, I'm Jennifer. I am Chief Fan Wrangler. If you haven't met me yet, you will. And I just wanted to put in a quick plug here for our second session. This is part 1 of 2. And our second session of State Partnership Fan 101 is going to be happening tomorrow from 2:30 to 3:20 in another breakout. So be sure to come back to us because we have more great information for you.